Hey everyone, and welcome to the Modern Management of the Older Adult podcast, brought to you by the Institute of Clinical Excellence. My name's Ellen Seppi. I've been a teaching assistant with the MMOA division of ICE for the past 4 years, and I'm so grateful for the work that we get to do both in live courses and online courses. And I'm going to be real, it might be easy to paint this facade that we always stick the landing with our patients and that we always emphasize strength and that we're always focusing on the right outcomes. And I'm going to be honest. For sure, our course and our content have shaped my clinical practice as a physical therapist. But if I'm honest, I've had quite a few plops along the way. Quite a few instances where I haven't shown up with the best outcome measures. I haven't had the best skills to really do the intervention that I wanted. And I've learned from lots of mistakes. And I have a patient who, all of our patients deserve our best care, but one specifically in mind who really captured this failure of mine as a clinician. So the topic of conversation, the title of this podcast is going to be my biggest failure as a clinician turned into a win, because that's really what happened over the past few weeks of my treatment plan with a patient that I care very, very much for. So I have a patient, I've worked with her for 8 years, as long as I've had the job with the clinic that I'm in. And I care for her very much. To the extent, as my grandmother was ill and dying, she wrote her a card. This is a patient who buys me socks, who makes baby blankets for my daughter, who has been a part of every major life change for me as a clinician and who really cares about me. And I have given her what I could, but it was poor. And I'd love for you to learn from my mistake, because it didn't just stop when I started teaching with ICE 4 years ago. It unfortunately perpetuated. So let me tell you about this patient that I care very much for. We'll call her Abby. So Abby is 65 now. She was in her late 50s when we first met, and she has lived with chronic obesity and disability for decades. She's had arthritis, rheumatoid arthritis, diabetes, 2 shoulder replacements, lower cervical fusion, bilateral knee replacements, spine injections. She's had many falls. She was in the hospital several times throughout my course of treatment with her, and I thought that she may die. The situation looked so dire. This is a person who has had chronic pain, and what I did poorly throughout my course of treatment is spot treat. I cared about her. She'd come in, something else hurt, something else hurt. And these were joints that really limited her function. My shoulder hurt, my neck hurt, my back hurt, my hip hurt, I'm falling. And I didn't have the confidence to say, or the skills to really focus in on what was the root cause of the problem, which was progressive weakness and poorly managed health. And what we could do for this person and this individual was somewhat limited up until recently. So this is a shameless plug, so commercial break, as I'm telling you about Abby and how things turned around for her. If you have taken or are taking one of our online or live courses, you have 3 months of free access to our virtual ICE programming, which where I'm going with this is tomorrow I'm going to be hosting an hour-long lecture on motivational interviewing and treating patients with obesity. And it changed my practice for this patient, and it changed my practice to prepare for all of my patients who are on GLP-1 meds, who need to exercise, who need a champion in their corner saying, I believe in you. You are the champion. I'm here to cheer you on. And I'm going to be hosting that that virtual ICE mentorship tomorrow at 8:30 p.m. Eastern Standard Time. So that will be tomorrow, August 25th. If you want to be there, I will highlight in depth the skills of motivational interviewing and the process with which I used to help Abby really turn things around. But I'll give you the bullet notes or the bullet points for how to learn that even the patients that you're thinking of when you hear my story about Abby could potentially benefit. So Abby has had falls. She comes in. What does she want? She doesn't really want to do strength training because it's always hurt her. She had months of pain after trying to be on a stationary bike. Pool access is limited. She can barely walk without getting very winded or falling or being in pain. And she's coming to me because I have for years taken that pain away successfully. My biggest failure is that I missed the opportunity to manage her health comprehensively and encourage strength training. And so she's falling, she's going in and out of the hospital. And I find myself in this very empathetic, very caring butt massage for years of my career. Instead of focusing and saying, I know what the problem is, she knows what the problem is, we need to work on it. I got lost in the empathy that I had as a clinician and let myself get lost in the sauce of doing dry needling and hands on therapy and the bare minimum of exercise that really didn't leave her stronger. So, this perpetuated for several years. I unfortunately always thought of this patient that I love. I love her. I care about her. I hug her. She has shared parts of her story and her health with me that have really changed my view of patients. For example, as I'm preparing to talk about this motivational interviewing vice tomorrow, I talked with her about how to understand patients with obesity, and she gave me new lenses with which to understand patients. For years now, she has been somebody who's helped guide my clinical understanding of what it was like to live with obesity. For example, she shared with me that when she goes into public for the longest time, she weighs 360 pounds. She and weighs, I think, 5'4". She takes off her glasses because she doesn't want to see how people look at her. She has had numerous orthopedists tell her, you really just need to lose weight. Like she doesn't have a scale or a mirror. She has people in her life who comment on her weight constantly, like open season, just constantly talking about her weight. And it's a topic that she can't avoid, and it impacts almost every area of her health. So, how it got turned around. So, this patient, Abby, started taking GLP-1 medications to manage her diabetes and obesity. And it has been successful. She's lost about 40 pounds so far. But you and I know as a clinician that while that is excellent to manage your weight and to improve your mobility, reduce pain, improve inflammation, we know that those medications can be helpful to address all of those considerations. But we also know that there is a risk of losing muscle mass and function, especially if you're already weak. So if you have a patient who's taking GLP-1 medications, it's ringing around in our head that, man, now there's kind of some element of urgency here. Now you're losing muscle potentially even faster. And this patient who I love is having falls more frequently because she's lost the muscle that helps protect her from those falls. This is important to consider because at this point, I recognized I have to do something. And I love this person. I really care about her. So, how do I turn the patient whose care I would not want televised because I'm not doing what's best for her according to my best clinical judgment? Where do I find the clinical skills to really support her with the skills that are necessary? And the answer to that is motivational interviewing. So, motivational interviewing really flips the script. For a lot of people, you think of a healthcare interaction and you think of somebody kind of barking at you. You need to exercise. You need to lose weight. You need to quit smoking. These are your numbers. This is what you need to do about it. I'm going to prescribe this medication. I want to see these numbers better by the next time you come in. Really authoritarian, telling you what you need to hear. Motivational interviewing really changed. It was developed by Stephen Rolnick in the field of psychology to understand, how do you get people and patients to do what you want them to? Like, how do you inspire people to be the captain of their own ship? And that's what tomorrow's virtual ICE is going to be all about. So, how I turned my biggest clinical failure into a win is that this patient and I agreed that, hey, we're losing muscle. This is now important. This medication can impact your function substantially and make falls more frequent. This is now urgent that we get this taken care of. How do we turn it around? From that point, I use the SPPB, a clinical tool that we talk about in our classes to address people who are at high fall risk, to really capture their deficits in strength, gait, and balance. So we did the right clinical measure. Didn't take long. She still got her valuable butt rub and dry needling, felt better, felt like $1,000,000. And we captured that, hey, if we can agree that this one thing, doing a sit to stand, would really help keep your legs stronger so that you're less likely to fall, you would be less likely to have this fall. We didn't focus on steps. We didn't focus on deadlifting. We didn't focus on upper body pressing. We didn't focus on fiber or protein. We really focused on what was necessary, and that was leg strength to keep her from falling. And we came up with a plan together. And now she doesn't fall. She improved substantially in the SPPB. The MCID for that measure is 1 point, and she made a 3-point improvement and is now falling much, much less and has much less pain. So, if I could inspire you tonight, it's that, yeah, first off, we're not perfect. We've learned a lot, and we all have patients that we genuinely care for and love. And having the skills that go beyond just knowing what they need, but inspiring them to find the power to make that change on their own is really the goal of motivational interviewing. And I'm thankful that with the skills that we have learned in our courses together and knowing how to implement motivational interviewing appropriately for our patients, that this person is now going to enjoy more years of life, vertical and breathing. Thank you for joining me tonight. I hope that we can think of our biggest failures and turn that ship around with love. Thank you for joining me tonight.